Hi, my name's Jane Lewis and I'm here today with Emma Norman of Lichen Sclerosus UK, and we are discussing vulva cancer campaign for this week. I have written a book called Me and My Menopausal Vagina, and as you see inside, this campaign is all about examining ourselves and learning about our vulvas. And for this week until Sunday the 12th of November, I will be giving £1 per book sold via my website at www.mymenopausalvagina.co.uk towards vulva cancer awareness and research. I'll now hand over to Emma Norman. Thank you.
Hi, I'm Emma from Lichen Sclerosus UK Awareness. I run the pages across Facebook, Twitter and Instagram. We have designed this, it's actually called the Know Your Vulva campaign, based around vulval cancer for this week. So throughout the week we will be giving information on symptoms, what to look for, knowing your vulva, the different parts of your vulva, so that when you go to a doctor you can actually give the correct terminology, and also how to do the vulva checks, which is so important. With the Know Your Vulva campaign, we will be running two other ones as well, which is going to link in with Jane. So one of them is going to be vaginal atrophy, which is going to run in December. And then in January, we are going to do a lichen sclerosus, also Know Your Vulva campaign.
Yeah, right. So thank you very much, Emma. I'm going to discuss my symptoms first, then Emma's going to discuss her symptoms. So I have something called vaginal atrophy that is actually very common, once more so when you've actually gone through menopause, but it can start in perimenopause. It can happen at other times, including when you've had a baby and breastfeeding, but we are predominantly talking about the menopausal years. And my symptoms were and are, they are a bit better, a lot better than they were, but it is soreness, itching, atrophy, and that includes reduction of the clitoral hood, the inner labia, itching, burning, and constant UTIs. So what's your symptoms?
My symptoms are very similar to the vaginal atrophy symptoms, in that actually the biggest symptoms are especially the burning sensation around the vulva, the itching, which can be very intense, and the white patches as well is the biggest, one of the biggest symptoms, where they believe autoimmune is to blame, so an overactive immune system attacking the skin cells.
So from there, my treatment is local estrogen, and to be given post steroids for me with vaginal atrophy would be the worst thing ever, because my skin is thinning and it will make it thin even more. And I just use very good quality oils, whereas your treatment needs the steroid cream. Why is that?
Basically, the steroid treatment will help reduce the white patches, which tend to become quite thickened. So there is a lot of myth surrounding the steroid creams thinning the skin. It does, but it is designed to thin the thickened patches of the lichen sclerosus. But it does also help alleviate the itching and the burning. Not so much the fusing part of it, but I think at this point what they are hoping is to alleviate symptoms only. So basically that's what steroid is designed for, to alleviate the symptoms.
And do you use an emulsifier in between as well?
We do, yeah. I mean, there's a few different things, such as zero base. We are always told, obviously not to wash with soap containing products. I think that generally goes for anybody with a vulva though.
Yes, yeah, definitely.
But soap products tend to aggravate lichen sclerosus symptoms, make them a lot more intense. So they do say to us, use a good emollient to wash with. I personally use dermal cream, which has antimicrobial properties in it to help keep away any infections, especially with the cutting and tearing that does happen with lichen sclerosus. But also as a moisturiser as well, It's very important to keep the area moisturised because it does tend to dry out quite a lot with lichen sclerosus.
I mean, it's the same for vaginal atrophy. I have to moisturise once, if not twice a day. We have very, very similar symptoms, and I did have splitting and episiotomy splitting also, but they can lead to very different pathways if not picked up and treated correctly. Now, if lichen sclerosus is thought to be thrush for years and years and years, and it is left untreated, what is the potential, although rare, but what is the potential?
The potential is if it's left untreated for years, and it is most commonly diagnosed as thrush. I think generally it's about 10 years before people can get a diagnosis, correct diagnosis.
Right, okay, yeah.
Within those 10 years, if they've had symptoms previous to that for years, especially in childhood sufferers, the risk is about 5% that it can turn into vulval cancer.
And how does that change when it becomes, it looks like a vulvar cancer? How would ladies know? I mean, the whole point of this video is that you've got to start checking, which we will talk about in a minute, but what, is it open ulcers or lumps? Or
there is a lot of sores, definitely. If you're getting sores and they last a month or so, we always say make sure you go and get that looked at, because that is one of the biggest signs of vulvar cancer. So anything that lasts over a month, get it checked out. There are other symptoms as well. Obviously, not everybody gets all symptoms.
Yeah.
But there are other symptoms such as bleeding between periods. So
Right.
if you're getting
Oh
this,
really? Well, I didn't know that.
Yeah,
Right.
for vulvar cancer.
Vulvar cancer, right?
Yeah,
Okay.
yeah, absolutely. Bleeding between periods.
Yeah.
If you notice, which is where the vulva checks come into it, if you notice any red, dark or white patches appearing, can also be another sign of vulvar cancer. So definitely worth getting those checked as well.
Yeah, yeah, okay. And my understanding of lichen sclerosus is, because I only know a small amount of it about it, because I was misdiagnosed at the very beginning of my vaginal atrophy for a month, so I learned a lot for a month, but nothing like you, is that it is more common at the younger years and the older years. Obviously you can get it in between as well, but do we think, I know the medical profession aren't overly discussing it, but do we think there's an estrogen link because of those two correlations of lack of estrogen at both ends?
Yeah, I think there is. I know a lot of ladies, because obviously I do run a Lichen Sclerosus UK support group as well.
Yes.
And actually, quite a few ladies that I speak to, or if I read the posts on, they do use actually an estrogen cream, which I think does help with the symptoms of lichen sclerosus as well. So I think there is definitely a link in the estrogen or in hormones.
Yeah, and obviously as we get older anyway, it's very possible to have both lichen sclerosus and vaginal atrophy. So you do have to consider that, and perhaps discuss with your care consultant that maybe a local estrogen may help. Not that neither of us are medically qualified at all here. We are patient experts with our own condition, but you need to have conversations if things aren't improving, and perhaps local estrogen may help you. And then there's the autoimmune side.
Yes, obviously nothing has been confirmed. Research is very little on lichen sclerosus. However, they do believe that actually a big factor in getting lichen sclerosus is an autoimmune condition, in that the immune system is overactive, and so actually it will flag up areas of the body, or the skin cells especially, as being sort of antibodies, warning signs, and they will go in and they will attack it as if it's a virus, which is what causes the symptoms, and especially the dryness as well.
Yes, yeah.
So yeah, it's a big link.
Yeah.
Potentially, but to be autoimmune as well.
Okay. So you've mentioned some of the treatments, which are steroid treatment, and my understanding is you start off at X amount for so many days or weeks, and then it reduces, and then you get to a maintenance level. Is that how it works?
It is, yes. I think the recommended is to start at twice daily, so you only use a very small pea-sized amount, possibly about the tip of a finger size. Start at twice daily, so probably once in the morning, once in the evening, ideally probably after a bath, because once the skin's warmer, it tends to absorb it a bit better. So from the twice a day, you would use that for a month, and then you would reduce it down to once a day for a month, and then you would reduce it down again to sort of every other day for a month, and then after that, once a week.
For life?
a month, and then
Right, okay.
basically to keep going at once a week, which isn't going to be enough to thin the skin. So you can keep on with that. That's absolutely fine. If flare-ups happen, which they do, even on a maintenance dose, flare-ups can still happen. Then you recommended to go back to the beginning and start again.
Right, okay.
From the beginning and work back down again to get the symptoms under control.
Yes. And although it can't be cured, it's put in remission, can people live a normal life with it and be pain-free?
They can be pain-free, yes. They can live a generally normal life. It depends what stage they're at, and how severe the symptoms are.
Yes.
For me and people like me, where the symptoms are quite severe and the structural change is quite severe, you can live a pain-free life.
Yes.
However, if you try to have intercourse, it's you're going to be probably in pain for quite some time.
Which is the same actually with vaginal atrophy, although our so-called path isn't potentially as serious as yours at all. A lot of sex lives are, some people just can't have sex at all, or they have to think of alternative ways, or we have to use dilators to keep the sort of runway open, which I think is what some of you ladies have to do as well.
We do, yes.
So fusing.
Yeah, because of the fusing, because the skin around the vagina opening tends to become a lot more narrow. So actually we are encouraged to use dilators, which will come in sort of 8 different sizes, starting from I think as small as your little finger, going up to size 8, which is about the average size of a penis. And that just generally, gradually it will open up. The vagina opening.
Because ultimately we all have to carry on having smear tests and potential gynecological examinations.
We do, absolutely.
So it's important to keep this area, very important to keep it open. Yes. Do you know much about when children get it, or not? Is that not?
I know the youngest cases so far of children getting it are about 2 years old.
And is that soreness? Is that from soreness? How do they complain?
From soreness, from persistent itching.
Right.
They become very, very distressed, and actually a lot of parents will probably take them to a doctor, and again they will just be told, they've got a yeast infection or a bacterial infection, and they'll be given the wrong treatments for it, and of course that will continue, and then eventually, they'll probably spot the white patches, which is one of the biggest signs of lichen sclerosus, and say, yes, actually, I think they have got lichen sclerosus.
Right, okay.
So, definitely children from as young as 2 years old.
Yeah. So what about the myths regards treatments that some people use?
There's a few myths
on the internet.
On treatments. Obviously, a lot of people do tend to go through the natural route, which is absolutely fine. Essential oils, they are good for our skin, as we know. However, there are some things that are not so good that people do tend to try and use, such as borax, which is actually a washing powder sold in America. For some reason, people are getting it shipped over here, they're bathing in it, they're drinking it, which is even worse. And it's used for rat poisons. It's used. It's a very well known skin irritant actually, and borax themselves do post on their boxes that it is a skin irritant.
Yes.
If it's ingested, it can cause other cancers as well.
Right. Yeah.
There is a lot of other health risks to it.
Yeah.
Through this, I have managed to speak with the British Skin Foundation and the British Association of Dermatologists, explain to them what people are doing and the lengths people are actually going to try and get relief using the borax. And actually they did issue a statement on both of their websites against its use.
Okay.
And I believe borax themselves have actually emailed somebody as well, saying, there is no medical research into it.
Be careful.
Do not use it on your skin. It's designed as a laundry detergent, that's it.
Okay. Well, that is, I know one of the things that quite worries you, and on your forum, your website especially, about it. Yeah.
Absolutely.
So the whole point of this sort of video is, as we said, for this campaign called Go Purple, otherwise we've tried to be as purple as we can with nails and whatever. And this week is for vulva cancer. Now, thank goodness neither of us have vulva cancer, but none of us ever know. And because there are 5 gynecological cancers, and vaginal cancer and vulva are the 2 that really do get missed and forgotten about completely. Now, we all know it's ingrained in our heads from birth that we check our breasts every month, and we do that without thinking, in the shower, in the bath. But how many of you check your vulvas? Probably almost nil. and we have simply got to start checking,
Absolutely.
looking and feeling every month when you've had your shower and you've checked your boobs, you get on the bed and you get your mirror out. Now you can get your little hand mirror from wherever, but if your eyesight isn't great like mine, or you're not very dexterous, etc., I have one of these ones and I lie on the bed and it self-supports, and I have a look, and I'd be warned, when you look at the magnifying side, it can be quite a shock when you first looked after 30 odd years. However, it's really, really important. And yeah, you say why is it important? What are they looking for?
Basically, performing your vulva checks is absolutely crucial. We, at the minute, are trying to say probably try and check once a week,
Right.
because then you can spot the changes that are
So
happening.
even more than once a month, okay.
Yeah, definitely, sort of about once a week. Because if you get that sore spot, or if you get a pimple, and most people will probably just dismiss it, and it can just be a case of it's a blocked pore or something like that.
Yeah.
However, if that pimple then starts to grow, you're going to notice it more checking each week,
Right.
and you're going to be able to start getting a bit more concerned about it, and be able to go to a doctor, get it checked out.
Yeah.
So yeah, definitely.
I must say I
Check your
check
vulva for-
weekly, because that is very good for me now, because I have become so paranoid. I was checking twice a day, not looking for vulvar cancer, because I was in so much discomfort. I could not believe that something could be so uncomfortable that I kept looking at it and thinking, what are you doing to me? It became a bit of an obsession. So
Yes.
but I do still roughly look once a week, but I thought it was once a month. But so yeah, once a week, so we know. We look at our face in the mirror every day, don't we? And if we have a spot here, we all seem to get a bit paranoid. As to why we've got that spot.
I've got a few
Yeah.
here, and I'm thinking, there's spots. But
So
the vulva checks
you-
they are so important to be able to check, especially if you haven't been diagnosed with anything, and you just think, you go through life thinking, well, everything's fine, I might get the odd bit of pain, or I might get the odd itch, and people think it's normal, and in a lot of cases it is normal. However, checking and visually looking, you're going to be able to spot things such as the white patches, especially, or even the fusing, like with lichen sclerosus, my labia minora has fused to my labia majora, so I've lost it completely, and that is a very common thing with lichen sclerosus. So by visually looking, you're going to be able to see that happening, and you're going to know something's wrong. You're going to go and get it checked out.
So once you do find something wrong, if you find something wrong, who do you go to?
We normally say first port call would be your GP, so your doctor to go to. If, however, you don't want to go to your doctor, you can go to a local gum clinic. I know there's a lot of stigma around going to these, because people just think they're for STIs. There's a lot of embarrassment about it, but actually it's not. They have so much knowledge about a various amount of conditions, and actually a lot of lichen sclerosus patients are diagnosed at a gum clinic or a local women's health clinic. So it's definitely worth going to see them if you don't feel comfortable going to your GP. Even nurses as well. If you're having a smear test, ask your nurse. If you're concerned about anything at all, just ask your nurse.
And if you're not happy with the diagnosis you've got, and there's a little bell ringing in here, then get a second opinion.
Always.
Or a third opinion. At the end of the day, it's your life, and vulvar cancer is rare, but if missed, the surgery and the treatment is
It's horrific, it's life-changing, it's completely life-changing. Not only physically is it life-changing, mentally as well, with any cancer. The emotional and the psychological effects it leaves behind, even if you get through that treatment, is just, you're going to need to go and see a professional.
So I think the point of, you can say your bit, the point of we're in the 21st century now, and it's time that women stopped shutting up and putting up, and being the stigma around saying the word vulva and vagina. People keep saying they say, oh, my vagina hurts. They actually mean it's their vulva hurts. You've got to start learning what everything's called, using the correct name, and teaching your daughters also to not be ashamed and giggly around their vaginal area, because I think there are more problems coming with all these smelly products that are being sold to us that we don't need to use. We don't need to smell like a rose garden. These smelly sanitary products, they're not good for us. They're chemicals that are done that, they're an irritant. shaving ourselves bare is causing more problems. Very, very tight jeans with thongs, all these things are making our areas more and more irritated as a general. So I think we just have to start talking and start being a bit sensible about what we are using down there regards washing, because ultimately, unless you have something like the lichens where you do need an emulsifier, or myself a bit of oil, the average lady we just need water. We do not need to be frothing up with God knows what coming out and bubbling everywhere.
No, absolutely.
And do you have any final?
No, my biggest thing is, make sure you do check your vulva. And if there is any problem whatsoever, please don't be embarrassed about going to speak to somebody about it, because actually it could save your life. You don't want to get a few years down the line, having ignored all the symptoms that have been there, all the warning signs, and then suddenly be told that you've got vulva cancer or vaginal cancer.
Yeah.
Get in there early and learn the symptoms, especially for lichen sclerosus, which can lead to vulva cancer in 5% of cases. Again, if left untreated. Learn the symptoms of vaginal atrophy as well. And if you're confused, because they are very similar, see a doctor, see somebody medical who can tell you exactly what it is. Sometimes with lichen sclerosus you may need a biopsy. A lot of times it can be done on a visual. Sometimes they will do a biopsy just to check, make sure you don't have precancer cells. Which is fine, and actually that's brilliant.
Well, that's just reminded me, precancer cells, about the HPV.
The HPV, yes. That plays a big role, it can play a big role in vulva cancer as well. Obviously, as we know, HPV tends to be sexually transmitted from the males, so they are doing the vaccinations in schools for the young girls, and actually they're now introducing it for the boys as well, which is fantastic. It can help eliminate things like cervical cancer, which is more commonly linked to, but actually there are types 16, 18 and 33 which play quite a big role in vulva cancer. If you have those types, it doesn't mean you will get vulva cancer, it just means you're at an increased risk, so you need to be checked more regularly for any changes. So HPV definitely, get tested. If you're having a smear, if you've had any abnormal cells at all, get your HPV tested and see what types you have.
I've just literally remembered this, there are also other skin conditions we can get, which is why it's very, you need to see someone, not self-treat with all this stuff that we can buy, because there are things called lichen planus, which is a different thing, a bit different to lichen sclerosus.
It's similar, but a bit different.
That one can go in the vagina, can't it? Lichen planus, where lichen sclerosus is outside. There's something called scleroderma, there's eczema, there's psoriasis, there are all things, and it's why we must not self-treat. Okay, if you had a constant dry sore patch on your face, you would be at the doctor. Go to the doctor, gum clinic, vulva dermatologist or gynaecologist for this. And I think that's it. I think we've done
I think that's it,
All right, bye.
Bye.